A Winnipeg family wants answers. They want to know how 55-year-old Stacey Ross died after an 11-hour wait in the St. Boniface Hospital emergency room. Her family says Ross had been sick since the holidays and had made multiple trips to the doctor, but was sent home. As you heard earlier, Manitoba's Health Minister Uzoma Azegwara says the case is being investigated as a critical incident. The minister also says the healthcare system has been dealing with challenges since the previous PC government.
Years of loss of capacity cuts, closing emergency rooms, losing staff, takes years to fix. And, Manitobans have been patient. It's kind of unfair to say, please keep being patient. We know that we have to keep our foot on the gas so that we can move things in the right direction. But ultimately, Manitobans deserve a system that responds in a timely manner. We're working to do that. And when tragedies take place, we must listen to families.
Minister, I appreciate that you are talking about pressures from previous governments. You are in government now. What are the pressures now?
The pressures right now are very real. We've added nearly 400 beds, fully staffed beds to the system. We've added full new units. We've added thousands of net new healthcare workers, and much more capacity is being added each and every day. But again, we didn't get to where we are overnight. I'm always very honest with Manitobans. It's going to take us time.
From earlier in the program, that's Health Minister Uzoma Azegwara. Joining us in studio now is progressive conservative health critic Kathleen Cook. Welcome back to the program.
Hi, Faith. Thanks for having me.
Let's talk about this latest ER-related death. What do you make of this?
Well, first of all, my heart goes out to Stacey Ross and her family, particularly her 19-year-old daughter, Morgan. They're dealing with an unimaginable tragedy right now. I think what concerns me as health critic is that this is not the first time that we've seen somebody pass away after waiting an unacceptably long time for care in an ER. This, to me, points to broader systemic issues, and I'm concerned that the current NDP government's approach is not going to get to the bottom of what those issues are.
What is the right approach, do you think?
I think it's time for a public inquiry. The minister talks about critical incident reviews, which have their place, but it's important for Manitobans to understand that critical incident reviews are entirely internal. There may be recommendations that come out of those reviews, but they are not made public. Nothing's been shared with the public about any changes that have been made as a result of Genevieve Price's death last year. Nothing's been made public about what's come out of Chad Giffin's death, and I'm concerned that if we limit investigation to a critical incident review, then there's no accountability to the public. And I think in order to restore Manitobans' confidence in emergency care, a public inquiry is needed.
What has the NDP said about those calls?
They've rejected them. They've said that it's not necessary. They talk about critical incident reviews. And again, as you've heard, they like to look to the past and blame the previous government. But what they failed to do is explain why things are actually getting worse under their watch. Median ER wait times in the city of Winnipeg right now are at a record highs. The median ER wait time is now over 4 hours. But if you've visited an ER at any point in recent months, you'll know you're typically waiting much longer than that. That's higher than it was under the previous PC government. It's higher than it was prior to COVID. Nothing the minister has said or done explains that.
Do you accept what the minister is saying about how it is the previous PC government's fault in more ways than one, that they're in this position?
No, and I think Manitobans' patience with that excuse is starting to wear thin. The NDP have been in power for 2.5 years now. They came to power on a promise to, quote unquote, fix healthcare. And so far, things have only gotten worse. ER wait times are longer. Many surgical and diagnostic wait times are longer. We've got 2 hospitals that have been grey-listed by the Manitoba Nurses Union, with a third vote for another grey-listing underway right now. I don't see that things are improving.
I want to go back to the critical incident here. Why do you think that's not enough in this case?
Because there's no accountability to the public. I think, I've been speaking with my own constituents even before this tragedy was reported, and they're concerned to go to the emergency room. And, I always tell them, of course, if you need emergency care, please go to the emergency room. But they're very worried that they're not going to get the care that they need. Especially when they hear stories like this. And I think that we need more than a critical incident review to restore Manitobans' confidence in healthcare.
If the NDP came to you and asked, how do we fix this in the shortest time possible, what would you say to them?
I think I'd point to a couple of different things. We still haven't seen a credible staffing plan with recruitment and retention and training targets from the NDP. They talk about a specific number of healthcare workers they say that they've hired, but they can't point to where those workers are. And even frontline healthcare workers have asked the question, where are they? And when it comes to ER care, we also need to be looking at issues of bed flow. They've so far failed to address what's sometimes referred to as bed block in Manitoba hospitals. And then there's certainly other issues that need to be addressed, like security and safety, that lead to facilities getting grey-listed, and it makes it hard to fill positions in those facilities.
We're, of course, talking about this because of the death of Stacey Ross. The minister talked about investigating this as a critical incident, even saying that all of the questions from the family will be answered. What to you would allow you to feel or to assess any answers to be acceptable?
We've heard this before. Whenever there's a tragedy like this, the minister extends their condolences and says that there will be a critical incident review. But nothing is said to the public about what changes are going to be made as a result of these tragedies. We need to know what is going to change as a result of Stacey Ross's tragic death. I think the public deserves to know.
Kathleen, thank you for this.
Thank you, Faith.